first Cornerstone Wellness Center, here to talk about all neuropathy and how they can help you reverse those symptoms. Joining me is Dr. Doug Kane, aka the Neuropathy Doctor from Cornerstone Wellness. Dr. Kane, it is a pleasure to have you back on Listens Live today.
It's nice to be here again.
Yeah, so a lot of people are probably recovering yesterday, today. Maybe they've been out the track and they're just at home relaxing their feet, because you're on your feet a lot if you're out of the track those times, and it's something, if you're dealing with other issues like neuropathy, well, you might be having a really difficult time today.
Yeah, well, the simple truth is, if you have very much neuropathy, you probably did not go to the track. And that's kind of what happens. They get to that point in life where things start passing them by, because the most comfortable thing for them to do is just sit in their chair at home.
And for those people who maybe it had been a tradition in their life forever, going out to the track Derby week, whether that was during the week or whether it was Oaks or Derby, and to have to sit at home and not do something that maybe had become a tradition in their life that they look forward to every year, that's a difficult thing to come to the realization of, just because of neuropathy, something that you generally can't control, whether it's caused by other chronic symptoms that you may have. But at the end of the day, that's why you do this. You hear these stories and you're able to help them look at their individual circumstances, figure out what the problem is, and then alleviate some of those symptoms, but also fix the problem at its root.
Absolutely. Well, I mean, it's not even just going to the track. I mean, we're famous here for our Derby parties, right? And but yeah, just the family gatherings and just simple things like that. Even just getting out of the house to see one of the grandkids, you know, baseball games or something like that. A good night's sleep. We had 2 reevaluations this morning, and that was something that both of them mentioned is for the first time in a long time now, since their feet doesn't bother them, you know, they couldn't stand the covers to touch their feet. Now they can actually get a good night's sleep, and how much better they feel in all facets of their life, just because they're better rested. So, you know, it doesn't have to be the big things. It's usually the small stuff.
And I think you were mentioning before the show started, there's a viral clip of one of your neuropathy patients that showed up in this viral video after the Derby weekend.
My staff was showing me this morning. So if you see the viral clip of the raw footage of Sherry DeVoe, there's a gentleman that walks up from the track and congratulates her. And he was actually one of our neuropathy patients that has been here and told his story on Wave 3. He is, by profession, he is a thoroughbred horse transporter.
Then it's got to be fun for you to see something like that, but also hear the stories day in, day out, like the ones you were just talking about this morning. So talk to me a little bit about where these stories all start. Talk about neuropathy, what it is, the problems it causes, and how you're able to help them get past that particular issue, depending on who they are.
Without overcomplicating it, it's simply your nerves aren't communicating with your brain properly. So we have abnormal sensation. Over time, that leads to pain. We can have balance issues, so there's significant fall risk. And so one of the things we typically hear is the patient said, well, I felt like there was a wrinkle in my sock, and there wasn't. Or sometimes they feel like there's a stone in their shoe. So just kind of abnormal sensations like that. You know, they get in the shower, they can't feel the hot water on their feet, but they can feel it on the rest of their body, or maybe their feet feel like they're cold all the time. So just those abnormal sensations. And a lot of times people will just kind of, you know, blow it off as part of aging, because, you know, it takes a long time for those issues to occur in the form of neuropathy. So, you know, we're usually dealing with folks that are 50, 60 and over. Almost 50% of your average 70-year-olds will have some degree of neuropathy. So, you know, they're talking with their other friends and they think, well, yeah, this is just a part of it. But it is the most common neurological diagnosis in America today, and it is a progressive degenerative condition, meaning it's not going to get better on its own. And so, yes, it does lead to some excruciating pain, lack of sleep. You don't want it to go anywhere. You just stay in, stay off of your feet, and it just completely ruins quality of life.
And what actually are you doing when they come in? Some of the techniques that you use to bring some of that sensation back to their whatever part of their body may be, whether it's feet, fingers. Usually it's feet, though.
Yeah. So yeah, usually it's feet just because they're the farthest away from the heart. We view it as, let's get at the root cause. We're root cause providers. We don't manage the disease. We're not interested in masking symptoms, although that does have a place. So it all comes down to circulation, and so that's what the pictures you're looking here. Believe it or not, this is the same patient 90 days apart. The one on the right side of the screen is what a normal thermal image scan should look like. We're looking at a patient that has good circulation, good blood perfusion at a capillary level. The one on the right screen was when the very first exam we did, and you can tell down by the toes we're seeing some yellows and some greens. And sometimes we'll see people where it's deep blue, purple, and even black, meaning they're absolutely getting no circulation to those toes, to those nerves. They begin to break down, and that's what causes the pain, the numbness, the abnormal sensation. And this is another device that we use. This is something called soft wave. It's actually an acoustic wave form. We have a device that has a head on it that kind of looks like an ultrasound. Oh, there you see it. And so what this is doing is we're inputting this acoustic wave. It opens up the capillaries. The picture you saw earlier, the kind of the dark blue foot was pre-treatment. The pink foot was post-treatment. And so now we've got good blood flow. The nerves can get the oxygen and nutrients they need, and they can begin that healing process. So we're one of the few people in the area that have this. It's pretty well new technology in the States. Been here about 4 years. We've had it for about 3.5 years of that. But it's very much caught on for a lot of other things. Most of your professional sports teams have them now. But yeah, it really helps a lot with our neuropathy patients.
MyDrKane.com. You can also call or text the number on that screen, 812-949-0900. About 15-20 seconds left here. Tell everybody what's going to happen to them when they come and see you at the Cornerstone Wellness.
We're going to do the most complete exam that you ever had with neuropathy. We're going to develop a plan, and we're going to get you on your way to recovering your quality of life so you have quantity to go with quality.
Well, Dr. Kane, as always, appreciate you joining us on the show today, looking for solutions for people that have those particular problems. Again, MyDrKane.com. The number's on the screen as well.